Now, have you checked your breasts this month? And if you have, do you know what kind of lumps require you to see a doctor? October is Breast Cancer Awareness Month, and we're here today to listen and learn kuhusu saratani ya matiti. I am your host, Dr. Lauren Mengesa, yani daktari wa kina mama. I am based at Akira Care and at the Nairobi Hospital. Now, on the show today, I am joined by Dr. Iram Shabir. Karibu sana, Daktari.
Thank you so much.
Now, Dr. Iram Shabir is a breast oncoplastic surgeon, and she's going to tell us in a bit exactly what that entails. She is based at the Nairobi West Hospital and at Machakos Level 5. Now, today we are going to be listening to one of our breast warriors, but before we get into that, we want to acknowledge our sponsors. Now, this show is brought to you by CIC Insurance. Now, CIC is there to journey with you if you get breast cancer through your visits to the hospital, through your checkups and surgeries, to their family Medisure plan. This covers each and every member of your family and makes sure your health needs are well taken care of. Now, if you're over 60 and you need a plan for yourself or your parents, then we have CIC Seniors Plan just for you. Now, do you belong to a chama, a men's group or a women's group? Then we have CIC Cop Care to take care of your group needs. Now, this week we are going to listen to one of our breast cancer warriors named Dionisa.
I was diagnosed in 2018. That was in August. But about the signs, about what I felt, it started in March. March, it's when I felt that I had a lump in my breast, and I was not even going on my usual duties. I was just taking a bath, and I felt like my breast was heavy on one side. I decided to consult, since I didn't have a clue. I had not heard about anything about cancer, so I thought it was a normal lump, since I was about to be on my menses. The following day I went to the office. I talked to my colleague. We went in one office. She just felt the lump. No, this is just the normal menses signs, so there is no need of worrying. It will go away. Actually, I didn't even know whether it went away or not. I kept quiet until after 5 months, when I touched and felt that the lump was still there. I decided to go to the hospital. Nikaenda hospitali hapo tu Embu, nikaenda kwa daktari, nikamwambia vile nasikia niko na lump kwa matiti. Akaniambia vile tutafanya, we will do an ultrasound. Tukiona hiyo lump ni kubwa, we will do a further test, but if it is a small one, then I will advise you on what we can do. After the ultrasound, the doctor saw the lump was large. I think it was measuring around 5 mm to 3 mm, I think something of the sort. To him, it was not a normal lump. So the doctor told me we will be forced to do a biopsy, and it was the same day. But to my mind, I don't know how naive I was, because I was feeling like it's normal, nothing to worry about. It's a lump which will be removed. Reason being, around 2001, I had experienced the same lump, which I was told was not cancerous, so I was not worried at all. We did a biopsy, which went for further scanning, and I was told to go for the results after 2 weeks. And on Monday, I decided that I can go and pick my results. He came and told me that now your results are out, and the lump is cancerous. I don't know why I was not shocked, because I didn't even cry. I only looked at him and I asked him, at what stage is it? Then he told me, no, the staging you will be given the staging later, but for now it shows like it's in stage 2. And I talked to the doctor that same day, and I told him, now, I have been told by our HR that there's a breast surgeon who deals specifically with the breast. Can you book for me? Actually, the doctor was so good. He booked for me that same day and told me to report the following day. So the following day, it was on a Wednesday. I will never forget, it was on 22nd of August, 2018. And the doctor told me, Dionisia, we will do so many scans so that we can determine whether we are going to remove the breast or we are going to remove part of it. And I told him it's okay. And he was telling me, I will book you to come after 2 weeks. I couldn't come after 2 weeks. Those were it was like a month. And I told him, I want you book me to come for surgery on a Monday. And he managed to book me and do the surgery. So we did the surgery on a Monday. And for me, I took it very positively, And the doctor told me in case I experience any problem, I should talk to him. Now this is the day for the review, that is after the removal of the catheter after 1 month. And the doctor tells me your results are out. We have examined the breast we removed, and the cancer is still in stage 3. It was so heartbreaking. Then here the doctor comes, I'll hand over to you to another one, and you start chemo. And I was taken to a doctor, and the doctor explained to me what is required. And it is shocking when a doctor akikwambia tutapima tena tuone kama imeguza mahali fulani, and you feel your heart like you are dying. I did the first chemo, and I will tell you it was hell. Before I arrived Embu from Nairobi, that is when I started feeling body weaknesses. I started sweating. I started feeling drowsy. By the time we arrived at Moya, I couldn't even talk. I was completely weak. By the time we got to Embu, I was vomiting everything. By the time I was in the 3rd week, my hair fell. I was left with no hair. Hizi zote za macho, hizi zote zikaisha. So here I am. That was the first brew. Despite not walking, now my hair is gone. By the time I do the second one, my whole body was black. My face was black. Miguu, na unajua unaenda bila matiti moja kwa sababu ushaambiwa na daktari usivae kitu because the wound is not yet healed. So imagine you have no hair, you have to balance yourself. Actually the hardest task is dressing when you are going somewhere. Unajiangalia, so I had always sijazoea kukaa na scarf and to buy a scarf so that ndio niwe najiekelea watu wasianze kuniona. Do you see, watu wengi hawajui what I'm going through. Saa hiyo niko na kazi, I have to protect my job because still I want to keep it, ndio inanilipia the medical cover. Number 3, I am in Embu. There is no cancer center that time, so I have to travel up to Nairobi. Hata Meru that time hakukuwa mahali ningeenda. So it was a very very tough journey kutoka Embu kukuja Nairobi after every 3 weeks. Ikafika mari nikarudi job. So nilikuwa nakaa nyumbani for 2 weeks, the 3rd week ama for 1 week. By the time nifike 2nd week mwili imepona, you can't even tell you have a problem. Narudi ndio inaanza kurudi pole pole. Nikaenda kazi. Kitui is hot. I have to wear a wig. Chemo yenyewe it causes the body to, it's like an early menopause. So you normally experience a lot of hot flash. I was not able to survive with a wig. I had to remove it and stay without hair. Na nikafikiria nikimaliza hizi 8 sasa chemo imeua any cells zenye zimebaki. To my surprise, daktari ananiambia sasa nilikuwa nataka kuangalia nijue utaenda radio ngapi, na nimeona utaenda 30 sessions. 30 sessions of radio. Where do I start? So nikamaliza that treatment. It really triggered my self-esteem. Actually all through was not high. Nilikuja nikienda chini, unapata there are some high moments, there are some very low moments, all that. Nimeanza kuvaa sasa hii artificial breast. Nikivaa hii ya kununua nikasikia pande moja ni mzito kabisa. The prosthesis, the silicone one. Hiyo pande moja juu nimetolewa the right one, unasikia ni mzito. But after niliwear the knitted one, nikasikia iko so right.
Na mambo haya kwa kweli ni mazito. You can see the roller coaster that is the journey of breast cancer, yani saratani ya matiti. Please share with us your experience on our SMS lines on 22422. Engage us on our socials at Uliza Daktari and at Daktari_Mengesa. Dr. Ram, karibu sana Uliza Daktari.
Thank you so much. I'm glad to be here.
Now, there is an interesting part of your title, oncoplastic surgeon. What does that mean, and what kind of surgeries do you do for the breast?
So it sounds like a very complex name, but it's not so complex. It's basically doctors who remove the tumors from the breast of these ladies, and at the same time we try to do it in such a way that we are able to maintain the shape of the breast, maybe not the size always, depending on how much volume we are going to remove, but we do try and restore the shape of the woman so that her womanhood is not affected. Yes.
And the breasts truly are part of what defines our femininity as women. And you can hear Dionysa's story and how she was worried about how she was going to have to, find a way of stuffing one side and make things, So Dionysa is all the way from Embu, and one of the things people are wondering probably is, what is this breast cancer? Maybe you can just tell us a little bit about the anatomy of the breast and what breast cancer is and what we look for as the signs and symptoms of breast cancer.
Yeah. So, the breast is actually, it's a gland, and it's made up of lobules and ducts, which are the primary components of the duct. So the structures in which the milk is made are called the lobules, and then the milk is carried to the nipple in pipes, if I could call them, called the ducts. Exactly. So, and on average, we have around maybe 15 to 20 ducts. Every woman has them. And then, because those are the main structures of the ducts, but of course, like any other organ in our body, the breast also has its blood supply, its connective tissue. So we have stromal tissue, we have mesenchymal tissue, we have blood vessels, we have nerves inside the breast. So the cancers that arise, most of them are the invasive ductal cancers. And by that I mean that they arise from those ducts that carry the milk to the nipple. So most of the cancers arise from there. In addition to that, some of the cancers, which we call lobular cancers, arise from the lobules that make those milk. So that occurs in women mostly, because men don't have so many lobules, you can imagine, because their breasts are not meant to produce milk. So basically that's what it is, and we need to appreciate that most breast cancers are invasive in nature. And if the cancer is extremely early in its stages, or what we call the precancerous lesions, that means that they are still within those ducts, within the pipes. Then we call them like ductal carcinomas in situ, which means that there is pathology which is metaplastic or has started forming into cancer in simple layman's language, but they're still restricted within the ducts. Compared to invasive ductal cancers, which means that now they have penetrated the walls of the duct, and that cancerous lesion has actually, it's growing inside the breast tissue. And mostly those are the ones that we feel as lumps. When they're within the ducts, most of the time they're not very easy to feel, you can imagine, because they're inside the ducts. And so that is how we have things like ductal carcinoma in situ. And ductal carcinoma is in situ, they don't always have to grow into invasive cancers unless they have other features. Like, for example, if it's a high-grade ductal carcinoma in situ, which means that the cells are really multiplying fast, so those ones can end up becoming invasive cancers. Likewise, but because the chances of them becoming cancerous is so high, we do treat them with a lot of attention. And if we don't, if the patient doesn't want treatment, then it's something that you have to discuss with her on a one-to-one basis. You have to make her understand why we want to, remove that area of the breast, or even the entire breast sometimes, because it is a very strong, so to say, precancerous lesion.
Na daktari, tatizo hili ni la wanawake peke yake ama wanaume pia wanaathirika?
Yeah, so no, it's also for wanaumes. So like 1% of breast cancers occur in men, and we, in our practice, it's not uncommon for me to see a male with breast cancer, and most of them are invasive cancers, invasive breast cancers, because invasive ductal cancers, sorry, because mostly the cancers in men do start from the ducts, but they can also be from other tissues in the breast. Like we have muscles in the breast, so they can be sarcomas as well. So even men can get breast cancer.
Wanaume tafadhali jongeeni karibu, manake pia nyinyi mnaweza athirika na saratani ya matiti. Now please don't touch the dial. After the break, we'll be looking at how to check your breast, when to see the doctor, and what are the signs and symptoms to look for with breast cancer. Now, Naam, saratani ya matiti ni mojawapo ya saratani ambayo wewe mwenyewe unaweza kuipata ukiwa pale pale nyumbani. Breast exam is something that every woman should do at least once every month. Naam, daktari, tungependa utueleze tu kidogo, ni vipi tukisema self breast exam, ni nini haswa tunafanya nyumbani ili tuweze kujiangalia na kujua kama tunaweza kuwa na tatizo?
So self breast exam is basically examination that a woman should do at home. Standing in front of a mirror, of course, so that she can see her breasts clearly. And the best time to do is a few days after your periods, maybe 3 to 4 to 5 days, because that's the time when the breast tissue is most tender, it's soft, easily palpated, yeah? So that's exactly what this diagram is trying to show. So you time yourself so that you're 1 week after your periods, and then you stand in front of a mirror, and because you want to give your breast a stretch, so you either put your hands up in the air, or you put them akimbo on the side of your hips, so that your breast tissue can be stretched out. Exactly. And then the first thing you're supposed to do standing in front of the mirror is to just do an inspection, which means you're looking at both your breasts and you're checking if your breasts appear, how basically they're appearing. Are they the same size or not? Do you feel one breast is becoming bigger than the other? Is there any abnormality in your nipples that you didn't notice before? Any abnormal skin changes? Of course, any lumps that you're able to pick up now that was not there. Basically, you're just trying to see if every month your breasts are looking the same
or change.
Yes, and if you pick anything that you feel is different from before, then you're supposed to get it checked further. So now after you've inspected yourself, then you have to feel your breast. And you don't use the tip of your fingers because the best area to palpate is from the palm. So you raise your right hand to examine the left breast and the left hand to examine the right breast. So with your hands propped up, you're supposed to start doing exactly the way this picture is showing. And what you normally do is you divide the breast into we divide the breast into 4 quadrants. And you can start with any quadrant. So if you find like the upper inner quadrant is easier, you start from there, you come in an anti-clockwise fashion to the outer quadrant, lower down, and then you come back to the inner quadrant. So it is the upper inner, upper outer, lower inner quadrant. And then you don't forget that you have a nipple in the middle. So you're supposed to then gently come and feel your nipple. Are you feeling any lumps or any hardness around the nipple that was not there before? And then you press it gently to see if there's any discharge. And if there's any discharge, please notice the color of that discharge, because it makes the doctor's work more easier if you're able to describe the discharge that you have. And then the breast tissue always extends into the axilla. So we have something we call the axillary tail of the breast tissue itself. So you have to come to the armpit here and then examine. And what you're examining is partly the axillary tail. And then after that, you want to examine the nodes. So because the breast tissue, it drains into the nodes in the axilla. So the nodes in the axilla, there are 4 groups, and you have to examine all the 4 groups. So you have the medial group, the anterior group, the posterior group, the medial group, and the lateral group. So if you watch a video, they're on YouTube. You can watch them on YouTube, but all the groups are there. And then you have to do the apical group. So that is how you complete your breast examination. And what you've done on the right breast, you have to do the same on the left breast.
Naam, tukitazama ile video kidogo ya kuonyesha vile tunaweza kuangalia matiti nyumbani, tunasema kwamba lazima usimame mbele ya kioo ili uweze kuona kama kuna tofauti. Exactly. Kuna moja pengine iko juu ama nyingine iko chini. Alafu pia utaweza kupapasa, uangalie kama kuna sehemu ambayo imevimba ama kuna mahali kuna uchungu. Pia ngozi kuna pengine wakati imebadilika rangi mahali ama imetoka rash ama chochote kama hicho. Alafu pia ufinya kidogo uone kama kuna chochote ambacho kinatoka kama discharge na ujue ni rangi ipi haswa.
Yes, exactly.
Naam, na tena muhimu ni vile daktari amesema, ujue titi pia linaingia hadi kidogo kwenye kwapa, ili kuweza kuona kama ile sehemu ya kwapa kuna chochote unaweza sikia pale. Naam, daktari, tupeleke kwa zile dalili ambazo unatafuta haswa, signs and symptoms hizo ambazo zinaonekana pia kwa breast cancer.
Okay. So the commonest symptom is obviously a breast lump. That I think most people know. But that is not the only symptom that we have for breast cancer. So we have, you can actually have like nipple discharge apart from the breast lump. So if we are to look at these pictures that I came with, so you can have like just skin, what we call skin puckering or skin thickening. So skin puckering is when you feel a side of your breast is getting pulled inwards. So it has a deformity, you know, like a tissue that is pulled inwards. So you can see that on the breast tissue. Then you can have just like an abnormal rash in your nipple, in your breast, sorry, that was not there before. And apart from the breast, more attention should be paid to the rash around the nipple because we have something called Paget's disease of the nipple. It's a type of cancer that we have, and that appears like a thickened rash-like whitish skin around the nipple. So you might confuse it for maybe eczema or psoriasis, but it's actually a form of invasive cancer that is found around the nipple area. So any abnormality in the skin coloration or the skin texture should also be taken note. Then you can have a nipple inversion. If a tumor is seated on the what we call the Cooper's ligaments, it can pull the nipple inwards or any part of the skin. So that is something you should note as well. And then, you know, if you have, although breast cancers don't usually present with pain most of the times, but sometimes when the lump is too big inside because it's causing pressure inside the breast tissue, which then compresses the normal breast tissue, some big lumps can cause pain. But otherwise, most breast cancers, unfortunately, are painless, and that is why the patients don't really pay much attention to them. But most benign conditions like fibrocystic breast disease, fibroadenomas, cystic diseases of the breast, they are very painful. So those make the patients come to the clinic even earlier because of the pain that they are feeling. Yeah.
Naam. Tuna swali kutoka Aisha, anauliza mammogram haswa ni nini na inapimiwa wakati gani kwa mwezi na ni umri wowote ama kuna umri specific ambao unafanya mammogram. Haya, Ibrahim pia yosema kama unafanya mammogram, wakati mwingine unafanya mammogram alafu baadaye unaambiwa pia bado tena urudie kufanya kipimo cha ultrasound. So ni wakati gani unahitaji mammogram na wakati gani unahitaji ultrasound. So kidogo tu about investigations daktari. Tunataka kujua sasa wakati umeenda hospitali, ule upelelezi utafanywa ni wa aina gani? Tuambie kuhusu mammogram, kuhusu ultrasound and what else we check wakati tunafanya zile tests hospitalini.
Okay, so now whenever a lady comes to you with a breast lump, it will depend on her age because what happens, younger women have more breast tissue, their breasts are more dense. So we have used in our medical field a cutoff of 40 years, but that doesn't automatically apply to every patient. But generally we say women below 40 have more breast tissue, the breasts are more dense. So those ladies benefit more from an ultrasound vis-a-vis the ladies who are above 40, because those ones, their breasts are less dense. So we end up doing a mammogram for them. Now mammogram is basically just an X-ray of the breast. What they do is that we compress your breast tissue into between two plates, and then we take an X-ray profile. We take two views most of the times. We take a lateral and we take a medial an MLO view and a lateral view. So those two views are able to tell us the location of the lump, and also it's able to tell us if around the lump there's any abnormal calcifications. Like I spoke about ductal carcinoma in situ, those cancers don't present so frequently with lumps, although they can present with lumps, but most of the time they present with abnormal calcifications which are easily seen on the mammogram but cannot be seen on the ultrasound. Now sometimes even ladies above 40s, we do, if I find a patient, for example, who has a lump that looks very suspicious on a mammogram, because I did a mammogram because she's above 40, but her mammographic pictures show me that it looks like a suspicious lump. Of course, I'll take a core biopsy. So after a mammogram or an ultrasound, we normally take a core biopsy. Every breast lump, especially in ladies who are in their 30s, 40s, going upwards, every breast lump, we must take a core biopsy. Not an FNA only, because an FNA's sensitivity and specificity is not as good as a core biopsies is. So please, our ladies 30, 40, 50, 60 going up, let's take core biopsies for them. If you can, in your facility and you have the availability of the expertise, please do an ultrasound guided core biopsy, because that way you make sure that you get to the right lump and different aspects of that lump, but otherwise just do a normal biopsy. Now sometimes we still do a mammogram and we do an ultrasound for the same woman. Now why would I do that? I would do that because I want the ultrasound to check the nodes, the axillary nodes that we talked about. So the mammogram is not very sensitive or not very good to tell me if the nodes are involved or not. But on an ultrasound, there are certain features that we can see which guide us to whether the nodes in the axilla are involved or not involved. So that's why we end up doing an ultrasound to characterize the nodes. And also sometimes, you know, you might see some abnormal architectural distortion on a mammogram, which maybe the ultrasound can delineate better for you. Yeah.
Na mkina mama mnaambiwa kwamba kama umri wako umepita 40 lazima ufanye ile picha inaitwa mammogram. Whether umeona chochote ama umepata kitu ambalo umepapasa kwa titi lako, hiyo picha ni kama x-ray ya kuangalia kama kuna chochote kinaonekana kwa titi, na inatuweza kutuonyesha kama tunaweza kufanya upelelezi zaidi. Na pia lazima kama kuna kitu kimepatikana, kuna ile daktari anaita core biopsy, yani kuchukua nyama kidogo tu pale iende kwa lab ili tujue haswa huo uvimbe ni nini. Inaweza kuwa ni kansa, lakini wakati wengine unaweza kuwa ni infection ama shida nyingine tofauti, lakini hiyo biopsy ndio itatuelekeza. Reminding you that our sponsors on our show today are CIC Insurance, covering you on their family Medisure plan that covers your whole family, on their seniors plan for seniors above 60, and with their CIC COP care for your chamas and groups. Now, after the break, we'll be looking at our treatment options when it comes to cancer of the breast. Karibuni tena. Na mwanzo tulisikia hadithi ya Dionisa akitueleza ile alipitia kutoka wakati aligundua kwamba ana saratani ya matiti, zile tiba ambazo alipata. Na daktari, ningependa tu kujua, what do you think? Alisema kwamba alipatikana na stage 2?
Stage 3, I think alisema.
Stage T2, I think it was T2.
Okay.
Ya kansa. Na ningependa utueleze tu maoni yako kuhusu vile alifanya ile chemotherapy, radiotherapy. When do we do what? Nani anapata chemo, nani anapata radio?
Okay. So unajua now breast cancer, I think the first thing is to know what kind of cancer you have. So there we do something we call, tunafanya test ambayo inaitwa immunohistochemistry kwa hiyo sample ambayo tunachukua ya biopsy. So immunohistochemistry inatuambia which kind of cancer you have. And some cancers, they are more responsive to chemotherapy. So we call them like the triple negative cancers or the HER2 positive cancers. So I don't know in her case now which type of cancer she had, but if especially you have those kind of cancers, then you should start with chemotherapy first. And also another factor to consider is the size of the lump. But most of the times, kama size ni kubwa, that means maybe more than 2 centimeters, because breast cancer, we grade it into different depending on the size. So we have T1, T2, T3, T4. So T1 is less than 2 centimeters. So if it's a T1 tumor, and then you have a tumor which is, I would say, receptor positive for cancer, then that means you can still go for surgery first. And then depending on what we find from the histology of the surgery and how many nodes were involved and many factors that we take into consideration to make it simple, we will decide whether we need to give you chemo already or not. But sometimes patients who are receptor positive do escape chemotherapy. They don't always have to get the chemo. But now the cancers like triple negative and HER2 positive, because those cancers respond so well to chemo, and then they also have other forms of treatment like targeted therapy or immunotherapy that we can use on them, then those patients, mostly we prefer them to get chemo. And most of the times we prefer them to get chemo before the surgery is done. Generally, if you give chemo before the surgery then you can assess the response of the treatment that you're giving. Sometimes such patients end up getting a complete, what we call a complete pathological response, which means that the tumor just disappears completely, even on the histology sample. So you see, that's a very good prognosis for these patients. And also, apart from assessing response, inasaidia kushrink, kupunguza size ya hiyo cancer. Exactly. Sorry, my Kiswahili is not so good. But it helps to reduce the size, which means that these ladies don't have to get a mastectomy. So we can do breast conserving surgery. And in today's world, we can also do so many forms of reconstructions for them, so that we are removing the tumor, yes, but we're also able to maintain the shape of the breast by doing either reconstruction from her own breast tissue, or then we can bring some tissue from somewhere else in the body, or even put foreign tissue and do a lot, so that her womanhood is, as I said, maintained.
Nafikiri ni muhimu sana kwa sababu watu wengi wanahofia kabisa ukifanyiwa hiyo operation, jamani utabaki na umbo lipi, because you're scared that the shape of the breast will change, and even when you dress inaka very obvious kuna tatizo mahali. So you're saying that these surgeries actually can help to give a shape even after surgery. It's not necessarily just going to be left, you know, as a flat surface.
Actually, that is something that I think we really need to portray out there. That now cancer doesn't mean the woman has to lose her breast. There are a few times that we are forced to do that because of the stage at which the patient presented. But most of the times we are able to maintain her shape, and we are able to symmetralize the Iopandengine, so that the shape, the size, both the sides are the same. So we're able to do that and do symmetralization surgery, which is really good for, I mean, it's good because it's not just her outlook, it also has, you know, apart from herself, how the society perceives her, how her family perceives her, you know, even how her husband perceives her. Everything changes when a woman loses her breast. A lot changes. I mean, I know of women who have lost their marriages because simply she lost her breast. And that's a reality that we have to live with. It happens, whether it's right or wrong, it's happening out there. So I think we need to be very careful before we go and remove a woman's breast, because know that you're going to do a lot to her just by removing her breast, and please don't remove it unless it's extremely necessary.
Now, one of the things we noticed during the story was her talking about getting menopause-like symptoms while on treatment, and we're curious to know why is that. Alafu kuna swali hapa kutoka Eric anasema, je, ni kuna uwezekano daktari wa kupata kansa kwa pande zote mbili za titi na zikiwa ziko tofauti? Tuseme unaweza pata right side ni T3 na left side ni T1, and then what do you do in such a case?
So I mean, you can get cancer, multiple cancers in one breast, either multifocal or multicentric, or you can get cancers on both sides. And cancers on both sides mostly happen in women who have, like, you know, they have hereditary genetic mutations, so it's not uncommon. So we have quite a few genetic mutations. Also, although genetic and hereditary cancers are not the majority type of cancers that women get, most of them are sporadic, which means they just occur. But around, maybe I would say around 10 to 15% of cancers are either hereditary or they're genetic. And if you have such a mutation, then yes, you can get breast cancer on both the sides, and they can present completely differently. Not only the size, even the type of cancer that they are can be extremely, they can be extremely different. You know, it's not, sometimes even in a breast lump, I have seen cases where we take a biopsy, you know, and we send it for histology, and it just turns out to be a benign fibroadenoma, something very benign. And then when we go in and remove the tumor, it does come back as an invasive cancer. So you have to, I think it's also about with time you build your experience and what you're perceiving on the images, the mammograms, the ultrasounds, and also your personal experience. You get to know whether this lump, it looks very suspicious, so why is a biopsy showing me a fibroadenoma? So you also have to have that, you know, thinking out of the box kind of mentality when you're treating these women, because cancers or anything else in our body doesn't follow textbooks. So we have to be careful how we approach this.
Naam, umeongelea kuhusu recurrence of these cancers. Wakati umetibiwa for the cancer, does this cancer go away completely? What are the chances or odds of it coming back?
Yeah, so well, there's always that risk. that the cancer can come back, because I think even the most experienced surgeon in the world cannot remove your entire breast tissue. That's also a reality. So even when we do a mastectomy, we remove maybe 98% of the tissue, but we are not able to remove each and every cell
that has
of breast tissue from you. So you have a risk of recurrence, but we follow you up. It's not like you've come to us, we've treated you, we've removed the lump, we've given you chemo, and we've given you radio, and then now we let you go. Because once you have cancer, that woman becomes at a higher risk of getting cancer in the contralateral breast. So we have to check your contralateral breast for at least the following 5 years to make sure that you don't get anything in the other breast. And as you're doing that, you will be checking also this breast when you come for the clinic visit. So even after your treatment, it's important to keep going back to the hospital once in a year to check the contralateral breast, and also check the same side where, especially if what you had was a lumpectomy, which is removal of the tumor only. So remember, we've left the breast tissue there. So of course there is always a risk of recurrence. Yes.
Tumezungumzia mambo ya urithi, yani inheritance, the cancers that are kind of inherited. Na utafiti unatuonyesha kwamba kuna zile genes ambazo zimeonekana kuwa zaidi kwa wale ambao wanapata saratani ya matiti, the BRCAs 1 and 2.
Yes.
So could you tell us about genetic testing and screening? Nani anafanyia utafiti kama huu na unapatikana wapi kama hapa Kenya?
Okay, so well, you see, breast cancers, some of them are genetic, as I said, and it's true most of them are BRCA1 and BRCA2 genes, but apart from that, there is a whole array of genes that can cause breast cancer. So there's a P10, there's a P53, I don't know, there's STK11, there's CDH1. Yeah, there are many. And what we do if you have cancer in your family, if it's just one relative who has cancer in your family, for example, your mother had cancer, but there is no history of cancer anywhere else in your family, then this person doesn't qualify exactly to be called a person who has high risk of getting a hereditary breast cancer. So what we do is that when that person comes to us, we put you in a scoring system. Like we have many scoring systems online. IB scoring system is one of them, and I think IB scoring system is accepted in most cancer places, breast cancer places. So we also use that in our setup. I use that a lot, and we put a lot of information about that particular patient in that scoring system, and then at the end of the score we get a percentage of the risk for this particular patient. So depending on her family history, what kind of cancers they had, at what age those people who had the cancers got those cancers, what is the exposure to radiation, what is this patient's exposure to hormones, and many other things, and then we get the score and we're able to decide whether she's at high risk or not. Now only the patients who are at high risk of being possibly having familial kind of breast cancers, then we send them to a genetic expert, not necessarily to go and check all the genes, to do the gene testing. So we have a genetic counselor, and she will do her assessment. She's the expert at it. So once she has done the assessment and she feels that you require the genetic testing, then they will go ahead and do the genetic testing for you. Now, if you ask me in Kenya where we have this genetic testing, I would think in most major hospitals, like I'm not sure if in the government sector it's available because it's not cheap. So I haven't heard of any government facility where it's being done. If it is being done, I'm not aware. But yes, I think at Aga Khan and in places like Nairobi Hospital, those ones would be sending the samples out of the country for genetic testing. So I think, yeah, those are the hospitals.
Thank you so much, Dr. Iram, for joining us today. It was lovely, lovely having you, and thank you for teaching us a lot about breast cancer.
You're most welcome. It was wonderful being here. Thank you.
Asante. Now, October is Breast Cancer Awareness. So please tell a friend to tell a friend that this month they need to check their breasts, and every month after that. Screenings are available to see if there's something wrong. So if you find something, then you need to get it checked. Na hata kama hakuna chochote, if you're over the age of 40, tafadhali, kuna mammogram, kuna ultrasound. Let's check our breasts and let's make sure we fight cancer together. Until next week, I'm your host, Dr. Lauren Mengesta. See you next Sunday on Uliza Daktari.
Uliza